Hello, on this video we are going to discuss the AP axial Towne Skull X-ray. So the picture in the center here is just an image that highlights the anatomy that we would be able to identify on an AP axial Towne's X-ray. So remember, the AP axial Towne's X-ray is to demonstrate the occipital bone of the skull, which is in the posterior side of our skull. This image is done as an AP projection so that the occipital bone will lie on the table or up against the upright bucky as close to the IR as we can get it. The angulation will be caudal, 30 degrees to the OML if the patient is able to flex their chin enough to place the OML perpendicular to the IR. If they are not able to flex their chin enough to place the OML perpendicular, we can use the IOML perpendicular to the IR and angle 37 degrees caudal to the IOML. Now, what I like about this drawing is that it shows us those sutures nice and clear. We can see that lambdoidal suture, and that's really what we're going to try to find on these x-rays. Find that lambdoidal suture because the lambdoidal suture surrounds the occipital bone, which is our part of interest. So if we can identify that lambdoidal suture, then we can hone in and look and find that occipital bone encased right, within that lambdoidal suture. So this image here shows it so clearly and beautifully. So I love to look at this image here with the lambdoidal suture. Following it up, this would be the sagittal suture posteriorly in this image. So this is the lambdoidal suture here surrounding our occipital bone, which is beautifully centered on our image. So are we showing what we need on this image? Absolutely. We've got the occipital bone centered on the image. Beautiful. The technique is beautiful. The parietals are not burnt out. It's just a very, very nice image. Now looking at this image over here, does it look the same as this image? No, they don't look exactly alike, but guess what? They're different people. And different people have different skull morphologies and different conditions happening. So do they look different than each other? Sure. But are there many similarities that we can identify this as both of these as AP axial Towne's x-rays? Absolutely. So let's find the lambdoidal suture on this x-ray here. So I'm looking at these suture lines here. They're very similar, the way that those suture lines is very similar to the way these look. They look like little squiggle lines. I'm not speaking in anatomical terms or radiographic terms there, but they look little squiggly lines, and you can follow those little suture lines up and know that that occipital bone is centered on the image here. So we are demonstrating the full occipital bone on both images. Now we go a step further, knowing that we see the occipital bones here clearly, we want to make sure that we've flexed the chin enough or that we've used sufficient angulation, that our imaging technique was just right, that all of our factors were book perfect the way that I just described it. We will go straight to the foramen magnum. So this circle here is part of the foramen magnum. So we can find the foramen magnum here. Let's go over here and look at this one. This is the foramen magnum here. So you can see that gray, arched, rounded, circular shape, all right? So we can see it on both of them. We can see the foramen magnum here and here. Do they look exactly the same? No, they don't. They don't look exactly the same. Does that mean that this is not diagnostic? Absolutely not. They're both diagnostic images. Then we can look for the petrous ridges. So we'll look for the petrous ridges here, out laterally. They'll be elongated and kind of stretched out laterally. All right, that's the petrous portion of the temporal bone. We call it the petrous ridge. The very tip top of that little area there is the petrous ridge. You can see it really clearly right here. And then we'll go to look for the dorsum sella to be centered in the foramen magnum. So here, you can see a little shadow right in here of this dorsum sella, centered right in the foramen magnum, exactly where it needs to be. Dorsum sella centered in the foramen magnum. Now, I'm not going to lie to you, over here, I don't see the dorsum sella as clearly as I do here. because it's superimposed a little bit with part of these sinuses. We've got ethmoid and sphenoid sinuses here that are getting distorted with that angulation. See those sphenoid sinuses down here, and this is part of ethmoid and sphenoid sinuses. So over here we can see a very faint shadow. I know it's very hard to see, but there is a dorsum cella centered in this foramen magnum on this image. Now I've already determined that this is a good image because I can find the lambdoidal suture, I can find that occipital bone, and that's really what we're looking for. We're not looking for dorsum cella on this x-ray. It's not a dorsum cella x-ray. It's a Towne's x-ray for the occipital bone. So, if you can find that lambdoidal suture and identify the occipital bone within that lambdoidal suture and know that these are the parietals out here, then you should be able to identify this as both of these images as diagnostic AP axial Towne images. Another thing to look at is those mastoids. You can see the mastoids here. And we can find the condyles of the mandible are here. And then the rami of the mandible. So those are some things like the rami of the mandible here, the condyles are right in here, condyle here, rami here. So those are things that we can look for to identify tilt. So if one part of the mandible is higher than the other, then we have some tilt going on, right? For rotation, we can follow that foramen magnum again. So the foramen magnum should be centered. But if my patient starts to look towards their left in this direction, their face looking towards the left, then the foramen magnum will kind of float over here towards the right. If the patient looks towards their right side, then that foramen magnum, the back of their head, will kind of go over here towards the left. So that's how we would identify rotation and tilt on those images. Just two specific parts of anatomy you can go straight to. So for tilt, you can look for the mandible, those condyles of the mandible. You can also look at the petrous ridges. I guess the petrous ridges also show up very clearly. So on tilt, you could easily see tilt if one of the petrous ridges is higher than the other petrous ridge. That would identify tilt, right? So tilted, if the vertex is tilted towards the right side, then everything on the left is going to come up higher. Everything on the right is going to come down lower. So I hope that this was helpful. Thank you for watching.